Hello, I'm here once again with our Command Chief, Chief Master Sergeant Dina Mosley. I'm Brigadier General Kenyon Bell, and we're part of the installation team here at Sheppard Air Force Base. And today, this is another edition of Sheppard Speaks, and we're visiting with members of our medical group, specifically the Operational Medical Readiness Squadron, OMRS. And we're going to dive deep into OMRS and talk with our public health team, and they've been thrust right into the front line of everything going on here on the installation.
They absolutely have, and we've had many organizations that have been working hard to help us prevent and limit the spread of this horrible COVID-19 that we have going on right now. But public health has absolutely been at the forefront of everything that we've done here on our installation.
What's really interesting about public health is that we see everything regarding COVID-19 and their response and how they've helped the installation walk through this. And because of that, everybody now knows public health. As we joke with them, public health is now a dinner time name. Everybody knows about public health. But there are so many different aspects to public health that we just don't know about. And we're going to be able to see some of what they do outside of our COVID-19 response.
Yes, sir. And I'm excited to spend some time with our public health department today. And not only have they been helping us through COVID-19, but they're also helping us as we start preparing to go back to school. So they're answering questions. They're working with our local school districts. And so we certainly appreciate all the work that our public health professionals do for us. But now it's time to dive in and take a look at what they do behind the scenes.
So you're going to hear from two professionals within the public health arena today, Staff Sergeant Justin Marshall and Staff Sergeant Brittany Rancourt. Both of them have been around the public health arena for quite some time, and they are excited about being able to provide support here for the installation here at Sheppard Air Force Base. Let's take a look.
So I myself got here to Sheppard late February of this year, so right as COVID was kicking off is when I was in processing. To be completely honest, it's been a fun adventure. I've just hit just over 11 years in the Air Force total, and all of that being here in public health. Public health has many different attributes. We're kind of have the joke that we are jack of all trades, master of none. We specialize in deployment medicine, comm disease, food safety, preventative health assessments, occupational safety, and almost any other thing you can think of that is preventative medicine. The thing I love most about working in this clinic here at Sheppard Air Force Base has got to be the teamwork, to be completely honest. You know, public health does a lot, but we don't do it all. As long as we're here with our triage team, our lab team, our command leadership, and everybody else here in the clinic, it really is a tremendous support.
My favorite part about being a public health technician is ensuring that the base population is safe. I personally enjoy food inspections. During a deployment that I saw a massive infestation, and it was very rewarding being able to mitigate that infestation so the population could have safe food to eat. A public health technician works with a bunch of different sections. We go out and do food inspections across the base, making sure that the food that the base population is safe to eat. We also make sure that we stop the spread of infection. If somebody comes in with a communicable disease, we track down who they may have come in contact with, making sure that that disease is no longer spread. We also work with occupational health and ensuring that the base population who works close with hazardous noise or hazardous chemicals, that they are safely working with those hazards. For anybody interested in public health, I enjoy the career field. There's many things that we do, and it's not just being stuck doing one specific task. We have our hands in a lot of different areas, so every day is something different, and that's, for me, a rewarding aspect of the job.
So public health has been at the heart of everything that we've been doing with our COVID-19 response, with mitigation strategies, making sure that we stay safe here on the installation, as well as the activities that we do off the installation. But as you just saw, there is so much more to the public health arena.
Yes, sir. And the decisions that we've made here on the installation have been at the advice of our public health department. They've been so helpful in helping us move forward. And so, like the boss said, you just saw some of the things that they do behind the scenes when it comes to food safety and inspections and occupational safety. They are at the forefront. We're certainly proud of our team.
And the excitement that they exude for all of this behind the scenes support, it's just invigorating. So we want to thank the leadership team here within OMRS, Lieutenant Colonel Alicia Parkhill, the squadron commander, and her superintendent, Mess Sergeant Dwayne Thompson. So thank you very much for allowing us to come out and spend some time with you and your very important team that provides such a critical mission here for the members at Sheppard Air Force Base. Thank you all for watching again for another episode of Sheppard Speaks. We'll see you next week.